We're going to do a dermal filler treatment on Sarah just to bring back some vitality to her face.
So I'll probably only get one person a year who comes into the clinic and says, can I have my temples done? It's not, and when I recommend it, most people look at me very oddly going, what do you mean? But actually, this is one of the key areas that for many years, we as practitioners were just blind to. We didn't think about it. But when the temples are hollowed, subconsciously, we take that as a sign of extreme age or ill health. If you look in life, who has very hollow temples? So even if someone isn't unhealthy or very old, in this case, this lady here, it can give off that subconscious cue of someone being like that. So by filling out the hollows like the temples, not only do we bring so much vitality back to the face, but it also opens up the eyes, lifts the tail of the eyebrow, and even has positive influence on the cheek. And we see it time and time again. And I haven't had a single patient have their temples done who hasn't gone on about it for months later and how powerful it's been, and yet very, very subtle at the same time. The tear trough area, and that means counselling the patient, or if you come in as a patient, to understand that you don't want necessarily a perfect look straight after treatment. These products attract water, and you can always have a little bit more done as time goes on. Sometimes it does look perfect, but if it doesn't, you need to accept your practitioner's advice. It's really important in this area. So what I do is just sit Sarah up, just having done a little bit here. We've done 1.5 mils, not much. But if we just sit Sarah up a second, and we can just already have a look and see where we're at. And of course, the final point doesn't have to be today. We can do it in stages. But we can already, and remember in 3D, the impact is always going to be more powerful than on camera, which is kind of like a 2D image. But hopefully you can see that this temple now is a little bit fuller. We could do a little bit more just in this section here and a little bit just here, but already it's looking so much better than the other side. This has come out a little bit, and if you just turn to the side, you can see there's a little bit more projection, and we've lost that hollowing in the tear trough compared to this other side here. Hopefully we can see that. So now I'm going to do the chin, and then we'll look at one side and see how it compares. With a female face, we want nice soft curves flowing one into the other. Exception is a defined jawline and defined lips. Otherwise we want soft curves. So here there's squaring off of the chin. We can see there's some squaring off there. So whilst I'm doing something on the chin, I'm just going to improve this contour so we get a nice oval shape. On the female chin, we want the lowest point of the face to be just in the centre. And as we come away from that, we want to be going up, as opposed to the male chin where we want a squared off effect. Okay. Seen sadly on social media, people's chins having been done, and they get it made longer or a little bit more oval, and you can see that it just looks like they've got a lump in their chin, and you can't do that. If the chin needs projecting forwards or elongating, you have to work on the whole element, every element of the chin, to bring the whole structure forward. Otherwise it just looks like you've done, you know, literally one little bit and nothing else, and it won't look harmonious, and that's the whole point. It's not just about that one aspect. You've got to look at the whole structure, and then how does that fit within the face of the individual you're treating as well. I so often see people, in fact I've seen someone just before Sarah today come in, cheeks like a 20-year-old, rest of the face like an 80-year-old. Doesn't look balanced. Stop getting filler stuck in your cheeks if you've got hollowing here. Everything has to be balanced, and the thing is, people will get up and they'll look happy because they're so focused in on their cheek. They're going to look at their cheek in the mirror and go, yeah, you've given me great cheeks. They lose sight of the bigger picture. And that person, when they walk the street, someone's going to pass them and go, oh, there's something not right about that face. And that's what they're picking up on. They're picking up on disharmony. a lack of harmony. Each area needs to fit like it look like it belongs to the same face. So this can seem like such an insignificant area that I'm doing, but actually, what are we doing with dermal fillers? We are not doing your cheeks or your lips. We are creating 100 individually subtle, almost covert changes which cumulatively give you a very powerful impact but is undetectable to the unknowing eye. And all I'm doing here is this was hollowed, and I'm just softening that transition because, as I said, on the female face, we don't want to be able to really detect one zone to another. We want a smooth transition. If you're Brad Pitt, yes, that's going to look great on you. And there, we've done it. Now it's nice and soft. Okay, so there we have it. So we've softened the temple area a little bit here in what we call the preauricular area. Over here in the cheek and the tear trough. Again, looking here, I could probably do a little bit more in some of these areas, but we've done enough. First sitting, we can do some tweaks in maybe a couple of months' time. And then as I look from the side, just turn over there. We've improved this profile. And yes, it's not perfect. We're never aiming for perfection. But what I mean is, I could certainly improve that further, but I've opened this angle up. This was 90 degrees when we started, and it's now probably 110, 105, 110 degrees. So we've opened this angle up, extended the chin, this distance here. So this ratio is now more aligned with a youthful ratio. But of course, we can make this better. But as I say, I think I've done enough for today. And this is the first ever time we've done this on Sarah. And again, you can see she hasn't really got much swelling, and I don't expect her to swell a huge amount. There might be a little bit overnight. There might be one or two bruises that appear, but based on the treatment as it is, she hasn't actually got any bruise. And we've done it through a minimally invasive technique. So pretty much everything has been done through just a couple of entry points. And then I just did a little bit with a needle at that point there. Okay, so would you like to have a look?
Yeah.
Sarah, don't worry, look, it is subtle. It is subtle.
I can actually really see the difference. My temples and my under eyes as well, and that bit.
Oh.